Good morning, everyone, and thank you for joining us today. I am Tanya King, Executive Director of the Rhode Island Coalition Against Domestic Violence. October is National Domestic Violence Awareness Month, and we're calling the community in to recognize the signs of abuse and to be active bystanders, looking out for our fellow Rhode Island community members and learning how to step up to best support survivors. Today, you'll hear from advocates from the RICADV's network of member agencies who will share their experiences supporting victims of abuse throughout the COVID-19 pandemic. The advocates will share how the community can best support survivors and their families now and beyond the global pandemic. We are truly grateful you, our community, are joining us today because domestic abuse is a community issue and it deserves a community response. We thank you for being a part of this needed collective response. I'd like to welcome advocates from the RICADV member agencies, Blackstone Valley Advocacy Center, Domestic Violence Resource Center, South County, Elizabeth Buffer Chase Center, Women's Resource Center, Center for Southeast Asians, Family Services of Rhode Island, Macaulay Ministries, Progreso Latino, and YWCA Rhode Island. Thank you all for being here with us today. Next, I'd like to introduce Sarah Eckhoff, our Law Enforcement Training Coordinator, who will facilitate our Q&A panel. Good morning, Sarah.
Good morning, Tanya. Thank you so much. I'm so happy to be here. Before we get started with the Q&A panel, I just want to ask each panelist to introduce themselves, sharing your name, your agency, and your role. We can go ahead and get started with Sally from the Blackstone Valley Advocacy Center.
Good morning, everyone. My name is Sally, and I'm the Associate Director of Community Services for Blackstone Valley Advocacy Center.
Thank you, Sally. And now we'll go to Nada. Nada, I believe you're on mute.
Thank you. Good morning. I'm Nada De Jesus. I am the Director of Prevention at the Women's Resource Center.
Thank you. And we'll go to Donna.
Good morning. I'm Donna Coleman Gilmer from the Elizabeth Buckham Chase Center, and I am the Director of Residential Services.
Thank you, Donna. And now Mary.
Whoops. Good morning, everyone. My name is Mary Rhoda. I'm the Executive Director of the Domestic Violence Resource Center of South County.
Thank you. And we'll go to Mario.
Good morning. My name is Mario Bueno. I'm the Executive Director of Progreso Latino. We're an affiliate of the Rhode Island Coalition Against Domestic Violence.
Thank you, Mario. And then we'll go to Lisa.
Good morning, everyone. My name is Lisa DuPont. I am the Director of Programs at the Center for Southeast Asians.
Thank you, Lisa. And now we'll go to Fanta.
Hi, my name is Fanta Panabong. I am a program manager for victim services from the Center for Southeast Asians.
Thank you. And last but certainly not least, we'll go to Michelle.
Good morning, friends. I am Reverend Michelle Matat. I happen to be the administrator of the best place on earth. And in case you don't know that, that's Macaulay Village. I'm glad to be here with you this morning.
Thank you to all of our panelists. So now we're going to pivot to the Q&A portion of the panel. And we're going to start with the question, what are some of the ways your agency has seen or heard how COVID-19 has affected survivors of domestic violence? And how has your agency adapted to that need? And we'll start with Mary from the Domestic Violence Resource Center for this one.
Thank you, Sarah. I've decided to divide this into two different responses to that. So I want to talk about our survivors' limitations, and I also want to talk about our limitations because they impact each other dramatically. So when we were shut down due to COVID, well, I guess I'll start with our limitations. we didn't have staff at our drop-in center except for one person. We limited it to one person. So therefore, we did have access to our helpline services during the day. We also were available for drop-ins, but it was by appointment only, and that's never been the philosophy of our drop-in center. From the client's perspective, however, we all know this, they were impacted dramatically because they were probably home with their abuser 24/7. So even though we had time came around, so we had established a virtual support group, and we had counseling either virtually or preferably by phone. So we were able to offer that, but it wasn't necessarily something that could be accessed by our clients because they were probably home 24/7 with their abuser. If they weren't, they may not have had the private time to make the call or go online because they were probably home helping their children online, and they may not even have access to a computer. So we did offer services differently. We did the best we could, but not necessarily to the best, well, not necessarily in a way that our clients could actually access them. Then we had our court system. Our court, literally in South Kingston, in South County, closed down, the same in Newport. But we still had clients calling for protective orders, and we still had clients calling because they wanted to vacate. So we we have a 3-story drop-in center, and we call the basement the garden center, the gardens level. So in the garden level, we set up another court office. And we made it as COVID friendly as we could, as COVID safe as we could. People came in the back door, which is confidential. You can't see it from the street. We had safety barriers up. We had masks. We had everything. We had a laptop that only our clients used. We used a different laptop. We used systems virtually that were never considered to be safe enough before, and we utilized them. And I have to give a great shout out to to EBC, because our clients then had to travel, and I grew up in upstate New York, so this isn't really far to me, but in Rhode Island standards, they had to travel all the way to Kent County courthouse to see a judge and to be heard. So it didn't end there for court. When the restrictions were lifted, we had such a backlog and so many misinformed clients that were missed their time because they weren't informed, or they showed up and it canceled. So the backlog really did impact our court clients. As for residential, we're probably similar to everybody else. By NNEDV recommendations, we did limit the number of clients we had in our safe home by 50%. We were fortunate enough to receive money from United Way, Rhode Island Foundation, and the state to house people in hotels. But as we know, that's not the same as having case management, face-to-face time, support groups that are face-to-face. So while it was safe, it was rather isolated. I think that does it, except for in our residential program. We didn't even go face-to-face with our residential clients out of respect for safety. So work, case management, and so on was done by phone and by computer. So again, we all did the best we could. It wasn't perfect, but we were able to keep people safe.
Thank you, Mary. And we'll pivot to Mario from Progreso Latino for this same question.
Hi, yes, as an organization, we're focused in serving Latinos and immigrants especially. So our domestic violence program offers education, case management, legal support, and clinical support in Spanish. We were challenged during the pandemic because, as you know, Central Falls was kind of like the center of the pandemic at the beginning. And because we're in a small 1 square mile radius, the virus just, caused havoc here in this part of the community. And I know as well in other cities where you have multiple families living in one household. So we were really, really pressed in terms of what services we can offer, but we didn't stop during the pandemic. So we had people, front lines working with victims and assisting them in whatever possible way that we could. We focused on meeting the emergency needs of clients. And as you know, the financial insecurity faced during the pandemic for people living in poverty was exasperated. And it was really, really difficult for our team to manage through the crisis because of your own concerns about safety and trying to support your own families and all those issues that come up. However, both the people that we serve and the people working on our team were so valiant during the pandemic. That's still affecting us today with Delta. We have to be honest. We're still faced with not at the same level, but it's really affecting the families that we work with. And we just saw how difficult it was for people in these really difficult situations. As said before, living with your with the people causing you harm and not having choices to deal with that. So in our case, what we tried our best to do was to harness the resources in our community. Our mayor was so supportive, and his team during the pandemic, and encouraging volunteers to help. We had folks affected by the issues who needed to get food at home, who needed to get diapers at home, and so forth, because they had no transportation. And we had people, contribute and go and, and take food over to those people having those difficulties, and helping in whichever way possible. And it was a lesson to us that, you never know what will happen in the future. And this crisis has served for us to rethink how we serve the community, and to be more flexible in what we do, and to further engage people in the community as part of the solution. And I think that we're stronger for it. We're learning, and I hope that these lessons that we've learned during the pandemic in terms of helping the community will stay with us. Because it was and it continues to be a very challenging time for people in our community. And now with the housing crisis that we're experiencing, it's really impacting families, because housing prices are going up, and it's extremely difficult for someone making these financial decisions and facing the harms that they face at home to make those decisions. It's even harder now because apartments are so hard to find. This is a big crisis that is in fact impacting this community, and it's really tough. It's really tough for people in the community. So this is a challenge for us that we need to think about and try to solve with other leaders in the community, because it's not going away. And it's really difficult for these folks to find solutions, especially considering the high cost of rent that people in the community are facing, and not having choices. So with those challenges, we're challenged with helping people to have the strength and to address their concerns, and to be smart about that, regardless of the limitations that we're facing. But we're increasingly challenged with talent. The big organizations, big companies are challenged with obtaining talent. And in our case, we need bilingual talent, folks of different cultures to serve the community. And it's difficult to maintain talent. And that's a challenge for organizations during the pandemic and beyond, because big organizations that have a lot of resources are pulling in that talent. So, and we're also challenged with the lack of resources, as you all know, and now we're challenged. A lot of our institutions are challenged because our budgets have been cut. So despite that, I think that the solution is working with our community, building our support and education. And I think that thinking about serving the community and the needs, the special needs that we have, increasingly supporting the professionals that are working in this field, that are working tirelessly in this field. So these are issues that I know we're going to be working on as a coalition.
Thank you, Mario. And Sally from Blackstone Valley Advocacy Center, would you like to weigh in on this question as well?
Yes, I will. I will say that survivors were affected tremendously during this pandemic. from being home trapped with their abuser, isolated and having nowhere to go. We adapted, our agency adapted pretty quick. They provided us with laptops and phones, and we were able to speak to our clients via Zoom, via emails, and with our phones, we also did chat and also text messages. And when the restrictions were lifted a little bit better, more, we were able to meet with them in public places to keep that social distance, like in a park or open spaces. So, I mean, we did what we could with what we have.
Thank you, Sally. And last for this question, we're going to go to Donna from the Elizabeth Buckham Chase Center.
Well, a lot has been said, and so not to have to repeat it all, a lot of those things also happened at Elizabeth Buckham Chase Center. But one of the ironies in the beginning of the pandemic, we saw in our community-based programs, supplies were not available to the general public. So hence, for survivors and victims, it was even more difficult for them to get basic needs like toilet paper, toothpaste. So we were able to, through some wonderful funding, really beef up our community closet and provide a grab and go system at our agency to assist those individuals who were not in our shelter program, who needed those basic needs, gift cards, things of those natures. It was interesting also, as Mary had mentioned, the court system became overrode with so many victims needing support systems from court. And so with 2 courthouses closing down in the state of Rhode Island, as small as we may be, it still became a very overwhelming, taxing situation for the Kent County advocates, but they rose to the occasion like all advocates have done. Also, when I think about, again, I go back to that very beginning, the fear that beset the country, you know, we're dealing with individuals who are walking in fear daily. So that fear was tantamount for those many victims and survivors who were living with the abuser or still had a contact and not knowing what to do, not having immediate access to us. As much as we all went virtual, that need to actually sit in a room or sit in a building with an advocate was a very frightening, something that was missed by many of the men and women that we do serve. So when I think overall, the beginning times of the pandemic were very frightening. As we're coming out of it or as we're getting accustomed to what it looks like, it's still a very frightening process because many of us still are not able to fully meet with the victims in every avenue that they need us to meet in.
Thank you, Donna, and thank you to everyone who weighed in on that first question. Our next question is, what are some of the top most urgent needs that survivors have right now? And I'll ask Nada to get us started on that one.
So some of the most urgent needs survivors have right now is accessing affordable housing, transportation, finding reliable childcare, and being financially stable. The pandemic has made it very difficult for survivors to navigate through all these different challenges. For example, one of our transitional housing clients who received notice that they were approved for a Section 8 voucher because of the pandemic. Things are being not done in person. Everything is being done virtually. And unfortunately, this family did not have access to an internet. And she was very frightened that she would miss the opportunity to obtain the Section 8 voucher. And gladly, you know, one of our advocates was able to brainstorm and figure out how we can support her with making sure she's able to have access to the tools that she needed in order to make this appointment. And by doing so, we identify one of our office locations to meet, keeping in mind that we had to, you know, social distance, have masks on, have safety protocols in place, offer her a laptop and have access to the internet so that she was able to attend the appointment that was scheduled, because in the letter, very clearly it stated if you miss this appointment, you go right back on the list. And we would not have wanted that for our client. And that's such exciting news for a person who has been going from shelter to transitional to now obtaining permanent housing, to have that just slip away very easily. So with that being said, the pandemic did make a lot of things very challenging, and it still is, accessing or even meeting their doctor's appointment because things are still being done virtual. Most of our clients don't have access to these essential tools that they need in order for them to be able to meet their basic needs and attend their appointments.
Thank you for that, Nada. And we'll actually pivot back to Donna.
So as Nada has spoke, housing is a major factor. Unfortunately, domestic violence survivors become homeless by the situation that has placed them there. And so there is no fast track for domestic violence victims or survivors to get those coveted vouchers, to get subsidized housing for those who qualify. And so the greatest need has been some way to fast track our survivors into affordable housing, safe housing, subsidies where they're eligible. In communities statewide, unfortunately, there are a lot of places where we don't get into because the public transportation doesn't allow, as Nada has alluded, many of our clients to access the housing that may be available there. So moving into some of the suburbs is difficult simply because there's no public transportation to get them to the daycares and to jobs. But, I speak about housing daily because it's something that is, it's missing statewide, but it's really missing when we're dealing with that immediate survivor who, if they can avoid going into a shelter and moving into a new, safer location, it would change the whole process of what she's going through. Other systems that were difficult, we're becoming a community, we're becoming a country of everything is virtual. And so as mentioned by Nada, having access to the internet, having stable internet access. Once again, many parts of Rhode Island is very unstable. So having those systems so they can seek housing, so they can seek jobs, everything is online now, as well as the schools that are still doing distance learning days, needing that for their children. So those things that, I really saw, I see the need.
Thank you, Donna. And I'd like to bring in Michelle for this question as well.
Thank you, Donna, because I'm going to say the most urgent need survivors of DV are faced with is a simple word, housing, which I'm going to repeat 3 times today. We at Macaulay Village receive countless inquiries from moms caught in this violent environment who want to leave, who are ready to leave, who are desperate to leave, but who want a safe and secure place to go to before they make that decision. They need housing and they need it now. 50% of the calls that we receive here at the village on a daily basis are from moms who have left a violent home and who are currently doubling up with family or friends, often breaking the leasing rules and putting that family at risk. Many are sleeping in their cars. Many are afraid to enter the shelter system. They need housing and they need it now. And then we have our families who have left violence and who have come to live at Macaulay Village. They have begun to heal through counseling. They've begun to get back on their feet. They're ready to move out, but they lack the finances needed. With the average 1-bedroom going for $1,500 a month, they just do not have the financial resources to afford what is available out there. And because of COVID, the whole turnover in housing has just come to a virtual stop. They need affordable housing and they need it now. So for us at the village, we identify the #1 need for domestic victims as housing.
Thank you so much, Michelle. And finally, for this question, I'm going to bring in Vieta.
Hi. I'm going to repeat back with what everybody said. For us, it's been housing. One of the positive resources that we were able to get out of it is we help our clients apply for rent relief. One of the questions in there is, are you a victim of domestic violence? It does help out the victims, get their application looked at faster. I've been able to help a lot of clients to be able to get approved for, like, say, their security deposit in the first 3 months of housing, their rent paid due to rent relief. So that has been a big struggle for us to find housing for our clients. Also, for us, it's a language barrier for clients that come in here not speaking English or not knowing how to navigate through the different resources that are available. Like I had a client that came in and spoke no English. They came in and they didn't know all the resources that were available. They were leaving their abuser, but didn't know that she can apply for TDI. She can apply for emergency compensation, also for rent relief. But overall, it's been housing for us.
Thank you so much, Banta. So we're going to pivot now to the next question. And the next set of questions are around the idea of bystander intervention and community, how the community can help. So this question is, what should colleagues, neighbors, loved ones, friends, or anyone else look for to identify signs of domestic abuse? And we will start with Sally.
Okay, so as we all know, victims of domestic violence don't walk around with a sign saying I'm a victim of domestic violence. Certain signs that we can watch for and be good bystanders or active bystanders would be injuries, obviously, being isolated, and also being afraid to around their partners or significant other. As a good bystander, I would probably say that a good way to help somebody is to get education, resources, and be there to listen and not judge.
Thank you for that, Sally. And next, I'd ask Nada to answer this question.
So an example of a good bystander, if you think a friend or family member is in an abusive or unhealthy relationship, here's what you should do. You should talk to them privately and express concern by saying you've been worried about them, listen without judgment. And if they don't want to talk, then let them know that you will be there for them if they ever do want to talk to you. Also keep in mind, listening without judgment may make them feel comfortable opening up. And if they do disclose abuse, let them know you believe them. You can reassure them that they are not alone. This is not their fault, and you are here to help. And you are here to help them. Some useful things to say might be, no one deserves to be treated this way. You are not to blame, or just simply, what's happening is not your fault.
Thank you, Nada. And now we will go to Lisa.
Hello. So one of the things that I think is particularly helpful for the clients that we see at the Center for Southeast Asians is domestic violence is obviously one of the issues that's hidden in the culture and often silent. So it's a very tight-knit community, and people are very hesitant to share about things that are happening in their family, and especially based on their culture of trauma. They're almost become desensitized to being a victim of trauma. They feel like almost that is part of their normal life. So I would, reiterate what Nada said, is that being open and being willing to listen, and also look for signs of isolation, because that's really what the abuser does, is try to cut them off from their connected community. And especially if it's tight-knit community, you don't have very many people to turn to. So being an open ear to be able to listen non-judgmentally and not sometimes react, which is very difficult when you love somebody and they're your friend, to not be judgmental and to say, why do you keep going back? Or that's a dumb thing to do. That only adds on to the victim already feeling very, having low self-esteem and not feeling like they have power in their lives. So really being an empathetic ear and listening and going with them to places, I think is a huge thing, because if you look at it from their point of view, to go into a domestic violence shelter or to go talk to somebody about what's happening in their family, it's really scary. So, we try to provide at the Center for Southeast Asians culturally and linguistic appropriate services to help them come into the center and feel safe.
Thank you, Lisa. And so how do you help someone who's in an abusive relationship? What are some things that you can do to help them stay safe? And we will start with Donna for this question.
So a lot that has been said in identifying an abusive situation also speaks to helping someone stay safe. It's important to not go in and rescue. You put yourself and you put that individual at risk as well. However, knowing some resources that you can assist that survivor to access, as mentioned, like going with them, being that support, being that listening ear and staying with them through the process, setting up the various forms of safety plans. And safety plans are going to be very different. They're not cookie cutter. So it could be something as simply as, a quick call, on a day-to-day basis, or leave the lights on. If you have a front light, leave your lights on when there's a problem going on. Other ways of keeping someone safe is not letting too many people into what's going on, because that also can sometimes invalidate what that individual's feeling about. Many times a victim is very conscious of the abuser being attacked, and that puts them in a defensive mode. So really supporting that person where they are and hearing them, hearing what they need, let them be the driving force behind all this chaos. It's very common that when we want to help, we want to keep someone safe, we want to fix it for them. And fixing it is not what that individual is always looking for. They want guidance, they want support. As mentioned, there are shelters that are available. There is counseling. And many times an individual is not looking to leave the situation, but want to know, how can I live safe in this community, in this environment? So giving them resources and being that additional listening ear really helps a person recognize they're not crazy, that, there is help out there for me, and you are there for me. You're going to be there for me. So you might be that only person that individual can trust, and trust is so important. Do not tamper with the trust, be there. And it's hard. It's hard as a bystander, because you're going to hear things that are just sometimes will make you cringe, but no, that person is at a point where now I want to talk about it. I need help. Can you be that help person for me?
Thank you, Donna. And I'll invite Mary to weigh in on this question as well.
Thank you, Sarah. I'd like to reiterate everything that's been said before me. I think it's crucial that people understand they're not to blame. And Nada said that. They're not alone and they're not to blame. And when you tell someone that, we physically see people breathe a sigh of relief, as Donna said, to say, we're not crazy. I'm not imagining this. So again, listening and believing is just crucial to start the trusting relationship that needs to happen between someone coming in for assistance and an advocate. People say to me, are your programs successful? And I say, well, define success, because not everybody who comes to us wants to leave. And we need to listen, we need to hear, and we need to support their decisions. So we encourage people to call the 1-800 number if they need emergency help right away. We give out emergency cell phones that dial one contact number and a 911 call. But to what everybody else has said, we listen with no judgment. It's confidential. We reassure that. we assist with their choices. We give people choices. We don't make choices. So when someone says, what do I do? We respond with, what would you like to do? And the first answer is usually, if they want to leave, they need a safe home. They need a safe place to go, which is the biggest challenge. I agree with everybody. Housing is a huge challenge. So we give them some resources and allow them to choose what they want to do next. And then they say, what do we do next? And we say, what do you want to do next? And then so they make their decisions. We give them the resources, we give them hopefully the strength and the confidence to make those steps. And to Donna's point, well, we also encourage support groups, because we find that people who really do understand other people who have gone through this believe that they can be successful in whatever their decision is to be safe. The safety plan is crucial, and it's an individualized plan for everybody. So we talk about planning for an emergency leave. We talk about planning for a long-term leave, if that's what the person has decided they want to do. Sometimes people just need to learn when they need to step away if the situation is escalating, or they need to learn how they can de-escalate. So it's not all about leaving, but it's about safety planning. It's about helping with any of the resources. If people say, I eventually want to leave, we hopefully can help them get that to all the emergency, to the points about when people leave, they go to emergency shelter, hopefully, and then where do they go after that? We try to help them find housing ahead of time if that's their plan. But it's about believing, it's about confidentiality, it's about listening, and it's about supporting, and it's about a safety plan.
Thank you, Mary.
Welcome.
So as a community, how can we be proactive and step up to prevent and eliminate domestic violence? And for this one, we'll start with Michelle.
Well, friends, let's think about this for a moment. If 1 in 10 people suffer from diabetes, and that's considered a health issue, and if 1 in 6 people suffer from heart disease, and that's considered a health issue, and if we can believe the latest study coming out of Columbia's School of Public Health, that 1 in 3 people had COVID in America. And we all know that COVID was not only a national public health issue, but an international public health issue. Why isn't domestic violence? Why doesn't DV receive the same funding, the same level of response? If 1 in 3 women and 1 in 4 males are victims, let alone all the countless children who have been privy to violence, is it not time for us to raise the awareness to even a newer level than we are right now? Yes, we can write our leaders in government, we can raise our voices for policy change, but also on a grassroots level. Explore with our friends, our sisters, our aunts, our mothers. Because if 1 in 3 are victims, chances are there's someone we know who is. Explore with them and invite a conversation. That is wrong for someone to control our bodies, wrong for someone to control who our friends can be. Let's stand in solidarity with them and offer them, as you all have said, places to go, helping them to raise their voice and to say no, no more. So friends, we're gonna leave you with that nugget. Let us start thinking about DV as a public health issue. And together we can stamp out and, I believe, end domestic violence.
Thank you, Michelle. And I'll ask Mario to weigh in here as well.
Thank you, Sarah. I concur with the previous speaker about this, and I apologize as my speaker here from my office. But I think we've learned a lot through the pandemic. We've learned that organizations can't just focus on addressing the symptoms, but need to focus on the root causes. However, we should be involving as a coalition and as organizations, other organizations that may not be identified as domestic violence intervention and prevention organizations, because I think all organizations in the community play a role. And educating people working in government, educating people working in education and healthcare. I think that it's important that we value their support, and because they have an important role to play in addressing the issue. Housing being such an important issue that's been echoed over and over again. This is something where we can't do it alone as a coalition. We have to involve policymakers, we have to involve the community, and we have to build power within the community, which means that we have to involve the community in finding solutions to these issues. And that means involving families that are touched by this issue, and involving young people as well. So it's harder than we think and that we imagine to involve people, especially because people are just trying to survive every day. And to say, hey, you know what, you can go to the legislature and speak to your senator or to your representative is not what the conversation that we usually have. And if I'm just trying to survive and I'm homeless, why should I care about what's happening to my fellow man or woman? So I think it's important that wherever we work, wherever we are, that we are thoughtful about this issue, that we all have a role to play in making a better community, and that we have a lot of work as organizations to do to push it to the next level. Because I can say that Progreso Latino is a service organization, but we're trying really hard to engage the people that we work with that are volunteering so that they can be a voice in finding solutions. And that's hard work. And so that's what I encourage. I encourage that at the community level, we have more ambassadors and advocates on this issue that can help the community at multiple levels. And that's about housing. It is about hunger and stopping hunger in our community. It's about helping our community have a better educational system that responds to the needs of families that are facing these issues. And so it's so important that we involve more and more partners on this issue. And I think that we are breaking ground, that we are making a difference, and we are doing better, but we have a long way to go.
Thank you for that, Mario. So we're approaching the end of our time here. So as we're closing, what's a message that you would like to share with the community about domestic violence? And this is open for anyone to answer.
Well, I prepared for that, so I'll start. And this is to not to my peers right here. This is to the people attending. In the United States, an average of 20 people are physically abused by intimate partners every minute. In our privileged United States, 1 in 3 women and 1 in 4 men have been physically abused by an intimate partner. Domestic violence, as everyone has now said and agrees, is a serious, widespread, and preventable public health issue. Thank you, Michelle, for bringing that up. It impacts individuals, families, our workplaces, and our society. And as much effort as we are all putting into this, it is not going away. So, general public, why do we tolerate this? Why do we let it happen? Why do we say, why don't you just leave? Why are the innocent people the one that face challenges and poverty and mental health issues? Why isn't it the abuser that's held accountable? And that's on us. Domestic violence can happen to anyone, any gender, any age, any sexual orientation, any income, any ethnicity. It's not just physical abuse. So we've talked about 1 in 3 men and 1 in 3 women and 1 in 4 men being physically abused. That does not include the dramatic numbers of people who are psychologically, emotionally, and sexually abused. Our society is being negatively impacted by this societal issue. It's a ripple effect that impacts the safety of our communities, even if it doesn't impact us individually. So I went online this morning to look at today's news. We all know about Gabby Petito and Brian Laundrie. Even if he is innocent until found guilty, but we know that they had a physical relationship, a physical altercation. Today, slain Instagram star's husband kills self because they suspect he killed his wife. Ankle monitor GPS used to find wife's body, husband arrested. Florida man killed fiance, staged fake crime scene at Walmart parking lot. We don't hear about the rest of us. We don't hear about the indigenous people. We don't hear about our local communities. We must continue to educate our communities about the negative impacts of DV on our society and our communities. So I want to give you an example of sometimes we know it takes guts to do what we do. So several years ago, I was at a health club and a doctor walked by and said, "Hey, Mary, I'm supposed to talk to you," because friends of ours were friends of mine were friends of his, and said, "You need to talk to Mary. You're a doctor. Do you talk about DV?" And I said, "Yeah, we'd like to come talk to your staff." And he said, "Why?" I said, "Well, do you ask if people are safe at home?" And he goes, well, what if I offend them? And I said, "And what if you don't ask and they die?" It just blew him away. We have to be that honest. We have to be that verbal, and we have to hold people accountable. Because right now, every effort we're doing, yes, we are making changes. And thank you, Mario, we're getting better. There is so much more to do, and we're not getting to the root problem. So until we get communities to uprise and change laws and hold abusers accountable, but that doesn't even fix the root cause. So I challenge everybody who's attending today to take a stand and to speak out, because your silence is affirming and allowing abusers to continue. Thank you.
Thank you, Mary. We're just right at the end of our time, but I just want to offer for any other panelist that wants to weigh in just briefly on this question.
I will, Sarah. I will say that as a community, I think we should educate ourselves a little bit more, talk to our children about what's healthy, what's not healthy, and also be there as a support. Not there to respond, you're there to listen as an advocate or as a family member. And I know we're still practicing social distance, but that doesn't mean social isolation. Thank you.
Thank you for that, Sally. Any last brief comments on this question? Okay, great.
I'd just like to say that we're all responsible for one another. You know, if we want to have a good community, we're responsible to make that happen, and that we should listen and be present to help whichever way possible. It may be, you know, sharing some food. It may be, you know, helping in whichever way you can. You will make a difference in that person's life, and we're not alone. As you can see here, you know, we have very capable people working on this issue. So never feel that you're alone. You can make a difference, and you know, together we can make people's lives better. So if you're listening today and you're in this situation, don't feel alone. Seek help. And even if they don't open the door or don't provide the help that you need, don't give up. Keep knocking. Somebody is going to open that door and help you. So don't lose hope.
Thank you very much for that, Mario. And at this time, I want to thank all of our panelists for sharing your experience, your wisdom, and the work that you've been doing during the pandemic and beyond. Thank you so much for sharing your time with us. I'll invite you at this time to turn off your cameras, and I'm going to go ahead and turn it back over to Tanya to close us out.
Thank you so much, Sarah. And thank you all so much for sharing your time and your wisdom with us. We so appreciate this and your commitment to serving survivors of domestic violence and their families in our state. particularly since March of 2020, when our world shifted with the COVID-19 pandemic. Advocates have been on the front lines, continuing to provide life-saving services, ensuring victims' needs were met in a time of layered crises. This work would not be possible without your dedication. I echo what advocates have shared about the needs survivors and their families have that must be met, and emphasize how crucial it is to invest in safe, affordable housing for survivors in our state. I'd like to thank all of our attendees for taking the time to be here learning from what the advocates have shared, listening to how the pandemic has impacted domestic violence in Rhode Island, and how we can best answer the call for survivors today and beyond. Thank you for your questions and for showing up for survivors. A recording will be sent out to participants. And should you have any questions, we encourage you to reach out. We have included some contact information on the slide here, including the confidential 24/7 statewide helpline, which can be reached by calling 1-800-494-8100 or using the online chat at www.helplineri.com. We also invite you to follow our statewide public awareness campaign, which can be seen and heard in ads and PSAs across the state, various radio interviews, and on social media. Lastly, and most importantly, I'd like to take a moment to speak directly to survivors who may be listening. If you feel you are walking on eggshells around your partner, if you feel your partner controls aspects of your life, or if you feel threatened by your partner, you may be in an abusive relationship. Please know support is available, and advocates are ready to hear your needs and questions and can work with you to determine the next steps following your lead. By working together in Rhode Island community, we can end domestic abuse and prevent this violence before it has a chance to start. Thank you so much.